I'm Dr. Pidikiti Madhu Bindu, Consultant Gynecologist and Obstetrician at Manipal Hospital Vijayawada. Today I'm going to speak about periconception care. Normally, a woman visits her obstetrician only during her pregnancy, but ideally, obstetric care starts several months before pregnancy or when the couple is planning to have a pregnancy. The goal is to have a good outcome for both the mother and baby. This has been endorsed by the US Public Health Services as early as in 1950s. In the present day, we see many couples planning their pregnancy in their mid-30s or even 40s. So, advanced maternal age comes with its own set of problems. One of them is infertility. There is 20% incidence of infertility if the woman's age is more than 35 years. There is decrease in the number of oocytes as well as the quality. Then increased chances of genetic abnormalities. Then adverse pregnancy outcomes. Apart from these women may already be having some medical illnesses. The goal of periconception care is to ensure that the couple are in their good health and practicing good lifestyle measures. We can identify any medical illnesses and treat them appropriately. Any infections which we identify in this period, we can safely treat them appropriately without any concern for their adverse effects on the fetus. So, the periconception care, the couple is advised to meet the doctor together. So, what are the components? What do we see? First, it starts with the medical examination and review of the medications that the woman is taking. So, the evaluation starts with the woman. So, if she is a diabetic, review of the diabetes control and optimization of the sugar control. If she is hypertensive, certain drugs need to be stopped. For example, thiazide diuretics, ACE inhibitors or angiotensin II receptor antagonists. Then, if she is asthmatic, proper control of asthma. If she has any history of DVT, deep vein thrombosis, change from warfarin to heparin is advised. Then if she has any history of autoimmune disorders like SLE, pregnancy is advised only during the latent phase. Then if she has cardiac illnesses, categorize the cardiac disease. If it is class 3 and class 4, it comes under a high risk pregnancy, and particularly severe pulmonary hypertension, Eisenmenger syndrome or aortic stenosis or severe heart failure. These are contraindications to pregnancy. So, all these medical disorders have to be thoroughly checked and the medications reviewed. Next, screen for any genetic disorders. Evaluate the family history and specific cases, then screen for cystic fibrosis, sickle cell anemia, thalassemia and certain cases of non-syndromic hearing losses. Then review the reproductive and obstetric history. So, the outcome of the previous pregnancies, any history of abortions or ectopics, counsel her about the chance of recurrence. Then any previous gynec surgeries like myomectomies, endometriosis, chocolate cyst excision, these have a chance of recurrence and these impact her chances of conceiving as well as have an effect on the pregnancy outcome. Then any history of PID, pelvic inflammatory diseases, and these can lead to infertility by causing blockage of tubes also. Then any history of PCOS. If she is a case of PCOS, see that the treatment is appropriate. Then living environment, diet, exercise, weight and any other supplementation of vitamins or minerals. So, it starts with the weight. The BMI should be ideal. If she is underweight, advise her to gain weight, and if she is obese, tell her to decrease the weight by appropriate lifestyle modifications, and morbidly obese, that is the BMI more than 30, advise a bariatric surgery if they are willing to. So, optimization of weight before planning for pregnancy is very essential. Then avoid hyperthermia like hot tubs and saunas, and certain habits like stop smoking, whether it is active smoking or passive smoking. Then alcohol, withhold from alcohol or other illegal drugs. Coming to vitamin supplementation, please see that the vitamin A and D are not to be taken in higher doses. Assess nutritional deficiencies like iron deficiency, anemia, B12 deficiency and correct them. And coming to folic acid supplements, any woman planning to conceive can be advised 400 micrograms of folic acid per day. If she has a history of epilepsy, the recommendation would be 1 milligram per day. And if there is any history of previous neural tube defects, the recommendation would be 4 milligrams per day of folic acid. Then exposure to toxic chemicals in household or even in workplace, that is also to be wary of. Then screening for infections, starting with HIV and syphilis, then hepatitis B immunization where required, then preconception immunization for rubella and varicella, because rubella can cause rubella syndrome. Almost 20% of maternal mortality can be caused by varicella pneumonia. Then avoidance of infections like toxoplasmosis, parvovirus by avoidance of pets and precautions in nursery and childcare. Then dental examination. Gingivitis is known to be a cause of preterm labor, so dental examination is mandatory. Then male assessment. So starts with his medical examination and review of the medications. So if the male has any medical illnesses, whether they are under optimal control or not, please we have to review them. Then sperm analysis, looking at the count as well as the motility. If there is any decrease in these, appropriate treatment should be initiated. Then advice about the lifestyle and their exposure to chemicals, habits, all this has to be discussed and reviewed with them. So peri-conception care, the goal is to optimize the health of the couple before embarking on pregnancy, and this can lead to good outcome for the mother as well as getting a healthy baby. Thank you.